lecture today. Our topic will be anemia, presented by myself, Chinazom Dukwu. Meaning of anemia. Anemia is a decrease in the red blood cell count or the hemoglobin values, resulting in a lower ability for the blood to carry oxygen to the body tissues. Literally, anemia can be, the word anemia can be split into two, and emia. An is without, emia is blood. So anemia can just literally be said to be without blood. Anemia is a condition in which the number of the red blood cells or the hemoglobin concentration within these red blood cells is found to be lower than normal. Anemia is a decrease in the oxygen carrying capacity due to quantitative and qualitative reduction in red blood cells count and hemoglobin levels. So from all these definitions, we can induce that there are two major things that are important when we're talking of anemia. The first one is the red blood cells count, and the second one is the hemoglobin, the concentration of the hemoglobin in the red blood cells. Sometimes the red blood cells, the counts could be within normal ranges, but the hemoglobin in the red blood cells are not as much as they should. The concentration is lower than it should be. So when it happens either of these ways, either the red blood cells count is lower than normal, or the red blood cell count can be normal, but the hemoglobin concentration of these red blood cells is below what it should be, then the person can be said to be anemic. This is because the hemoglobin is functioning, it has a function of carrying oxygen to different tissues in the body. So if the hemoglobin is not within the normal ranges, that the person will manifest with anemia. So the WHO has defined anemia as a hemoglobin level of lower than 12 grams per DL in the women and 13 grams per DL in the men. So hemoglobin is needed to carry oxygen. And if somebody has fewer than normal hemoglobin, that means the person is going to manifest with anemia. Also, if the red blood cells are abnormal or the red blood cells are fewer than they should be, the person will also manifest with anemia. So we are talking about two major things, like we said, the red blood cells and the hemoglobin. If any of these two is abnormal, the person will manifest with anemia. So if you look at the screen, you have a pictorial description of anemia. In anemia, you see that the red blood cells, the number of the red blood cells are fewer than they should. And in the other side of it, the normal red blood cell count, what the drop of blood by the left shows that this blood, this description, the person's blood has the normal red blood cell count. But in anemia, the red blood cell count is found to be lesser than it should be, thus reducing the oxygen carrying capacity of the blood. Next will be the pathophysiology of anemia. The first is the decrease in the red blood cells or the hemoglobin of the person's blood. So it's either the red blood cells are reduced, the count is reduced, or the hemoglobin, the concentration is reduced, or the hematocrit level, which deals directly with the hemoglobin, is reduced. It leads to anemia. So when any of these happens, it manifests with decreased oxygen capacity of the blood, because the red blood cells are the ones distributing the oxygen in the body. And what is actually distributing this oxygen in the red blood cells is the hemoglobin. So if any of these are decreased, that means the body won't get enough oxygen. And when this happens, there is what we call hypoxia. Hypo is lower and oxia is oxygen. That means the body will start manifesting with signs and symptoms of low oxygen, low level of oxygen. And that is when the person is said to start manifesting with signs and symptoms of anemia. So there are several factors that could cause anemia. The first one is nutrient deficiencies, especially iron deficiency, because iron is a very important part of the hemoglobin. The hem aspect of the hemoglobin is literally iron. So if a person is found to be deficient in iron, or the person is eating and the food the person is eating does not contain enough iron, that means the person with time is going to start manifesting with anemia, because the red blood cells will be there, but the hemoglobin will not have the iron to form the hem part of it. And it boils down to the person not having the capacity to carry not enough quantity of oxygen that the person needs. And the person will go down with signs and symptoms of anemia. Another thing that under the nutrient deficiencies, apart from the iron deficiency, is folate, vitamin B12, and vitamin A. All these are very important in formation of the hemoglobin in the body system. So if someone is deficient in any of these nutrients, it will lead to the person having anemia over time. Another cause of anemia is infection, like malaria, parasitic infections, tuberculosis, HIV. All these infections and others not mentioned here can, over time, lead in the destruction of the red blood cells. And if the red blood cells are destroyed more than they are manufactured, it goes down to the person developing anemia over time. Also, some inflammatory processes in the body can go ahead to destroy the red blood cells and lead to anemia. Chronic diseases, gynecological and obstetric conditions, whereby a woman may be pregnant and there could be some complications of pregnancies, and the woman must start bleeding and lose blood, and over time, the person will start manifesting the signs and symptoms of anemia. Other causes of anemia also include inherited red blood cell disorders, something like sickle cell disease, significant blood loss, inadequate production of red blood cells, excessive destruction of red blood cells, increased loss of iron, increased demand of iron. All these lead to anemia, because if the red blood cells carrying the hemoglobin, if they are destroyed more than they are built up in the body, if they are destroyed more than they are manufactured, the person will tend to have lower levels of red blood cells over time, and that leads to anemia. So classifications of anemia. Anemia can be classified on basis of cause of the anemic condition or morphology of the red blood cells. So when you are classifying anemia on the basis of the cause of the anemia, we can talk about blood loss. If someone has a wound, if someone is bleeding and the bleeding doesn't stop over time, the person will lose a lot of blood. In the process, the person will lose a lot of red blood cells and the person will go down with anemia. Inadequate production of normal red blood cells can also be one of the classifications under cause, because if the level of the rate at which the red blood cells is destroyed, if the rate is higher than the rate at which the red blood cells are produced in the body, the person will go down with anemia, because there will not be a balance. The rate of destruction is excessive and more than the rate at which the red blood cells are produced. So with time, the number of red blood cells in the body system will be depleted, and it will lead to the person going down with anemia. On the basis of morphology, that's the basis of the size or physical appearance of the red blood cells, the person can be anemic while the red blood cells are normal in shape. The person can also be anemic while the red blood cells, the sizes are smaller than it should. Or the next one is the person can be anemic, but when you view the red blood cells under the microscope, you see that the red blood cells are bigger than they should. Now, types of anemia. The first one described here will be megaloblastic anemia. It is a form of anemia characterized by very large red blood cells and a decrease in the number of these red blood cells. So when we are talking about mega means big. So whenever you see in the word mega, it means something is bigger than it should be. So megaloblastic anemia means that these red blood cells are bigger in size than they should be. And while they are bigger, their number will now be lesser than it should. This can be caused when someone has deficiency in vitamin B12 and folic acid. So if these red blood cells are bigger in size than they should, it is called megaloblastic. And what leads to that, what causes it, is when the person is not taking enough vitamin B12 and folic acid. Then the next one is iron deficiency anemia. Iron deficiency anemia is caused by lack of iron in the body. If the person is not having enough intake of iron to form the hemoglobin part of the red blood cells, the person will manifest with anemia. The third one is pernicious anemia. It is an autoimmune condition that prevents the body from absorbing vitamin B12. Vitamin B12 now helps with the formation of red blood cells. So if any autoimmune condition causes the body not to absorb vitamin B12, it now leads to malformation of the red blood cells. And that is what is called pernicious anemia. Another type of anemia is hemorrhagic anemia. This is the type of anemia caused by excessive bleeding. When someone, for example, if someone has an accident, road traffic accident on the road, and then the person has an injury, and in the course of transporting the person from the scene of accident to the hospital, if there is a lot of delay, or even when the person is taken to the hospital, if the person is not attended to immediately, the wound sutured, the bleeding stopped, the person will lose a lot of blood. In the process, the person would have lost a lot of red blood cells, and this will make the person go down with anemia. Another type of anemia is now hemolytic anemia. Hemolytic anemia is a disorder in which the red blood cells are destroyed faster than they are made. An example of this condition could be thalassemia anemia and sickle cell anemia. In these two cases, the red blood cells, because there is an abnormality with the red blood cells, they don't last as long as they should be. They're not as strong as they should be. They're not viable as they should be. That means they are going to be destroyed by the body system faster, earlier than they should. And when it happens, the person will go down with anemia. The third type of anemia is aplastic anemia. This is the deficiency of all types of blood cells caused by failure of the bone marrow development. If there is a problem with the bone marrow development of an individual, it will affect the rate at which the blood cells, all the blood cells are produced. And it will lead to the person having aplastic anemia. What are the signs and symptoms of anemia? One of the commonest signs and symptoms of anemia include easy fatigue and loss of energy. If you have noticed, those of us who have managed to work in the hospital settings, or even have experiences around us with our family members or friends, sometimes if somebody starts complaining of being easily fatigued or being tired so easily, it could just be a symptom of anemia. The person could just go for a checkup, go to the hospital and complain, and if some tests are run, the person would be noticed to have anemia. Unusually rapid heartbeat, particularly with exercise. When someone is having anemia, if someone is anemic, the heart beats faster. This is because the heart is trying its best to distribute the little oxygen it has, because in anemia, the body system is not having enough oxygen, like we have explained before. So if the heart will now be signal that the body tissues are not getting enough oxygen, so you need to work faster than you should. So if the heartbeat, the normal heartbeat of that person was 80 beats per minute, if the person is anemic, that 80 beats per minute will not be enough to distribute the oxygen all through the body system. So a signal will be sent to the heart, please, I'm not getting enough oxygen. And the heart will think that if I beat faster, I'm going to supply oxygen better, and which only ends up overworking the heart. So when the heart starts beating faster than it should, especially during exercises, in the process of trying to deliver the little oxygen the body has, it increases the heart rate. The normal heart rate of that person goes up. Then shortness of breath and headache, particularly with exercise, difficulty concentrating, dizziness, pale skin, leg cramps, insomnia. Dizziness means that when the blood supply to the brain doesn't have enough oxygen, the person will start feeling dizzy. When the person's skin starts becoming pale, that means the person is not getting enough oxygen, or the person's body is destroying the red blood cells more than it is producing the red blood cells. Other signs and symptoms of anemia include brittle nails, spoon-shaped nails. When you look at someone and the person's nails are like, the nail is like a spoon, the shape of a spoon, depressed, like the way a spoon is depressed at the middle. If you see something like that, it could just be a pointer that this person is suffering from anemia. Atrophy of the papilla of the tongue, angular stomatitis, brittle hair, dysphagia, and glottitis, poor vision. All these are part of the signs and symptoms of anemia. And this diagram also is a pictorial description of the signs and symptoms of anemia, the effect of anemia on each organ or tissue of the body, and how it manifests in a person suffering from anemia. Now, how is anemia diagnosed? Anemia can be diagnosed with different methods. The first one could be just physical examination, checking for pallor or rapid heart rate in a person or a patient. So upon physical examination, when you look at someone who is anemic, the person looks whiter than the other one who is normal. So even the palm of the hand, when you compare someone who is anemic, the palm of someone who is anemic to the palm of someone who is not anemic, the difference is always clear. There are also other places you check, like the sclera on the eyes, and you can pinch the nails and see how much blood returns after pinching it. So those are the physical examinations you can use to predict. You cannot authoritatively say that the person is anemic just by physical examination. Yes, you must, in a hospital environment, you must confirm with other blood tests. But there are some physical examinations that you do and you can predict that, oh, this person is down with anemia. Other forms of diagnosis is blood test. When you do complete blood count, it's going to tell you the amount of red blood cells, the amount of hemoglobin, the amount of blood cells in this person's system. And this could point to you knowing or confirming whether the person has anemia or not. Blood tests can also check the reticulocyte count, the serum iron, and the ferritin levels. All these are also pointers telling us whether the patient is having anemia or not, whether the person is anemic or not. Some other additional tests that we can use to diagnose anemia include bone marrow biopsy. When we check the bone marrow and see if there is any malformation in the bone marrow, if there is a malformation in the bone marrow which helps in the production of the red blood cells. If there is a problem with the bone marrow, automatically we should know that the red blood cells will not be produced as they should, and it will lead to the person being anemic. And we can also run some other tests to identify other underlying conditions like sickle cell and others. Treatment of anemia. How do we treat anemia? We treat anemia according to what is leading to the anemia. The person who is anemic, find out what is leading to that anemia, and then you treat it. Iron deficiency anemia. If you notice that this person, if after going for the blood test, you notice that the person's iron levels is low, you can try with iron supplements. The iron supplements or dietary changes giving the person food containing iron will now help to supplement the quantity of iron in the body system. It will add up to the number of iron in the person's body system, and it's going to help with the production of hemoglobin. And this will now increase the oxygen carrying capacity of the body, and the person will start getting better. When the person is down with anemia caused by vitamin deficiencies, try and find out what particular vitamin is the person deficient in. We can check all this with the blood test. So if you are able to identify the particular vitamin deficient in that particular individual, that means when you introduce that vitamin to the person through supplements, the person is going to get the vitamins he or she needs and recover from the anemic condition. So if it is aplastic anemia, it can be treated with medications, blood transfusions, bone marrow transplants. If it's hemolytic anemia, and you find out what is causing the hemolysis, the breakdown of the red blood cells, what is causing it? If you find out the cause, if it's infection, you treat that particular infection. If it's inflammation, you treat the inflammation. If it's autoimmune conditions, you treat the autoimmune condition. And when you do that, you have taken care of the cause of that hemolysis of the red blood cells, and the person will recover and again will come out from the anemic condition. So if the anemia is caused by sickle cell disease, then there are some certain things we do for sickle cell patients, which includes giving them pain relief, hydrating them, giving them enough fluid, blood transfusion, and a medication called hydroxyurea. So the major thing you have to consider when treating anemia of any kind is to find out what is actually causing the anemic condition, what is causing this person to be anemic. If you can pick out the cause and treat it, the person will recover from anemia. Then prevention of anemia. You can prevent anemia Some anemic conditions can be prevented with dietary measures, eating iron-rich food like meat, beans, fortified cereals, vitamin C, which helps in absorption of iron. Then you can use supplements to prevent anemia. When someone who is prone to have anemia is given supplements rich in iron and vitamins, it will help the person not to go down with anemia. And regular screenings, especially for those with chronic conditions or genetic predispositions. So if the person undergoes regular screenings, you could pick before the red blood cell counts go lower than they should, or lower before it goes so low that it will start the person starts manifesting with signs and symptoms. You could pick it that, oh, this person's red blood cells count is getting lower than it should. If you start giving the person some attention, if you start giving the person some medications, you could save that person's life. You could save that person from going down to severe anemia. So if with the regular screenings, your aim is to pick up when there is a reduction in the red blood cells count or a reduction in the hemoglobin, before that reduction goes down to a particular state that it will start manifesting with the signs and symptoms of anemia. You could start supporting this person with dietary measures, supplements that will help the person to build up the red blood cells, to build up the hemoglobin levels, and to improve the oxygen capacity of the body, the person's blood. So some complications of untreated anemia include severe fatigue, which impacts the quality of life. If the person is getting tired so easily, if the person is a student, going to school might become a problem. If the person is a worker, going to work might become a problem. If the person stops going to work because the person is so fatigued, so tired, if you do a little thing, something that you normally do before and nothing happens, you now engage in those activities and you're so tired that you cannot do any other thing, it impacts the quality of life. You won't live your life the way you want, and the person ends up not being happy. So some other complications of anemia includes pregnancy complications. If a pregnant woman is anemic, it could lead to the person having premature birth or babies with low birth weight. Another complication of anemia includes problems with the heart, because the heart is now beating faster than it should, because the heart is now experiencing irregular beating. It could affect the heart, and with time, over time, the heart may go into failure. Anemia can also lead to problem with growth. Children with anemia can later on have stunted growth, because what has led to these children's anemic condition could also affect their growth. So those are the complications of anemia when anemia is not properly treated. So that is the end of our topic today. Kindly ask your questions under this video, or you can also contact us with our email, and you can send us a message on WhatsApp. Thank you very much.